This video is for basic facial, and we will start the video as if I am just arriving to work. So the first thing that I would do is I would wash my hands. So I would go to the sink and I would wet my hands, and I would find a coin-size amount of liquid hand soap, and I would wet my hands, put that soap on, and wash my hands down to the wrists. I would wash the back of my hands down to the wrists. I would wash my fingers, and I would wash the backs of my fingers. I would wash my fingertips and nails. I would wash between my fingers and my thumbs. I would wash my thumbs, and I would wash my wrists. I would do all of that interlocking cleanse for a minimum of 20 to 30 seconds. And then I would do a really good thorough rinse underneath the water. And when I feel like it's properly rinsed, I would either grab some disposable paper towels or a clean towel. I'd turn the sink off with the towels, dry my hands thoroughly. The paper towels go in the trash. The dirty towel would go in a closed container until time for laundry. And then I would find my hand sanitizer that is 70% ethyl alcohol, and I would sanitize my hands to finish that, excuse me, to finish that hand wash. And then I would prepare my room. I'm just grabbing one other thing here to have my tray ready to show everybody. Strange. Very strange. Okay. I'll find that later, sorry. Then let's talk about what we'd need to do to prepare our room. Oh, okay, I found it, just one second. We would disinfect the workstation, bed, and equipment before our client arrives. We're going to do everything we can to set up to expedite time and be mindful of that for our clients. So we are going to get our room ready, obviously, before they get here. We're going to disinfect our workstation, bed, and equipment using a disinfectant wipe and following manufacturer's instructions. We're going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service and store in a clean, closed container. We're going to turn on the hot cabbie and stock with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We're going to fill a clean steamer glass with distilled water, and we're going to preheat the steamer. We're going to dispense products needed for the service according to skin type and client's needs as follows. We will prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray. Or we can remove the product with a disinfected or clean single-use spatula, close the lid to the product, and set the portion cup tray on the tray. We're going to drape our facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and a headband on top of the first towel along with a roll towel to support the head and neck of the client. Save the 3rd towel to lay across the client's décolleté. And what I'm going to do now is show you all my tray that has been prepared. And I was grabbing one other thing for my tray, which I see now, so I'm going to grab that. Let's just go over what I have here on my tray. So I have water, I have astringents, I have cotton rounds, I have wooden sticked Q-tips, I have those little disposable spatulas where you can take out product and then toss, 4x4s, a pair of disposable gloves, toner, my brush for my mask application, and then of course products, which for the video I can set up ahead of time. You can set up most everything that you need, and then you can just dispense what you would need based on client skincare maybe, or skin type maybe while they're changing, or when you're first starting. So of course, cleanser, exfoliant, massage, mask, eye cream, and moisturizer. And I was just going to get some more cotton rounds, and that's what I couldn't see where they were, but they're right here. So I'm just going to grab some more so we have enough for this facial. And so all this, of course, should be set up before my client arrives. And I'm just going to grab a sip here of my protein shake. My allergy, I don't know if you guys know, but there was a big bad storm, rainstorm, and my allergies are not serving me very well today. Okay, so I will be doing the client consult now. And anytime I do a client consultation, as you know, you would always approach the client with clean hands. So, of course, my hands are clean. I just cleaned them. I prepared the room. I'm going to wash them again before I start the service. But I just want to note that when I meet and greet with my client to do that consultation, that my hands are clean. So let's review what happens at a client consultation. We would greet the client and escort them to their work area. We're going to determine the client's preferences and assess the client's needs. We'll assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We will assess the client's consultation form for any medications and products used within the last 72 hours. We're going to consult on any known allergies. We're going to consult with the client on any facial surgeries within the last 3 months. And if the client's under a physician's care, we'll assess if the client is prone to cold sores or fever blisters. We'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acid, beta hydroxy acids, hydroquinone. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from the above contraindications, we can move forward with the procedure. And all that stuff is just super important. We're going to take the time to really make sure that they don't have any allergies to anything in our products, that they aren't on any medications. You really want to take the time to go into detail on all of those contraindications. So, because your job obviously is to choose the right things in the facial and also to protect your client and make sure that it's safe for them to have the service. So we don't rush through that. And then we will get the client comfortable. So she would have privacy because she would need to put a drape on so that she could have this out, her neck and her shoulders, etc. And then she would get into the facial bed. So she's comfortable. She's gotten under the sheets. We've got our towel on the head of the bed, horizontal, and now I'm going to do all the extra things. So we've got our roll towel that we are going to put underneath her neck for extra support. We have our hair net to keep her hair out of her face while we perform this service. And then I'm going to drape her with this additional towel. And then before I can start the service, I will be washing my hands. So I'll go to the sink, I'll wet my hands, I'll get that coin-sized amount of liquid hand soap, and I will wash my hands down to the wrists, and then I'm gonna wash the back of my hands down to the wrists. I'm gonna wash my fingers, and I'm gonna wash the backs of my fingers. I'm gonna wash my fingertips and nails. I'm gonna wash between my fingers. I'm gonna wash between my fingers and my thumbs. I'm gonna wash my thumb. I'm gonna wash my wrists. And I will do all of that interlocking washing movement for a minimum of 20 to 30 seconds. Then I'm gonna thoroughly rinse my hands off. So once I feel like it's properly rinsed, I'm gonna grab some disposable paper towels or a clean towel, turn the faucet off, dry my hands completely, throw away the paper towels or towel, and if it's a dirty towel now, it would just go into that laundry basket with a lid. It's got a closed container until it's time to do the laundry. And then grabbing my hand sanitizer, 70% ethyl alcohol, I'm going to sanitize my hands. And now I can begin the service. So the first thing that I'm going to do is remove any makeup that she might have on. And it just depends on your client. Sometimes they come in with makeup, sometimes they don't. Sometimes they wear a lot, sometimes they don't. So you just take it case by case, person by person, and you do what you need to do to remove that makeup. going to dry her off a little bit. And then we would do the first cleanse of the face. And then we're going to remove that cleanser. And then what you're going to do now is the skin assessment underneath the magnifying lamp or a woods lamp. So what you're going to need to do is cover your client's eyes to protect from the light. It's very bright. So we're going to cover her up, and then we would bring the magnifying lamp over, turn it on, and then we would start to look and analyze. And this is where we want to take some time, because in our discussion, in our client consultation, she gave me some specifics that she was concerned about. She's worried about dehydration. She's worried about dry, patchy areas and fine lines and wrinkles. So I'm going to be looking for those things, but I'm also just going to be checking everything out. And this is where it's important that I take my time to make sure that I see if there's anything I feel like that I can address in service or recommend that I know I can improve in service. Also, maybe some products that might support her at home. So I'm really kind of trying to just check it all out. And it may be that I'm looking for lots of different things. It could be hyperpigmentation. It could be excess sebum. It could be if she has any clogged pores or any kind of extractions, etc., that I might need to do. Or it might be that I'm looking just to learn her skin so that I can make notation either on my client profile card, or if I have a software system in there, anything that where she might have a mole or freckling, etc. So if there's any change going forward, I will be able to alert her if I think there's something that I need to talk to her about, maybe potentially having have a physician look at, or just also that you're just very aware of what's happening so that you can help her have the best skin possible, the healthiest skin possible, and then achieve her skincare goals, and of course beyond that. So I'm going to really just take my time and look everywhere on the face, the chin, the cheeks, the forehead, you know, just feeling and looking. And then when you're done, you turn the light off and you take it out of the way, and then you can remove the cotton rounds, which is what I'm going to do. So once that's done, it's time to cleanse again. Excuse me. Allergies, please go away. Okay. And then it's time for the third cleanse, third and final. And just want to make sure that you get all of the cleanse off. And I spilled some water over here, so I'm going to have to wipe that up real quick in just a second. I'm just going to clean this major water spill up real quick so I don't affect any electrical equipment. Be right back. Almost done. Done. Okay. So now that we have finished our cleanse, all 3 cleanses, it is time to tone. So I'm going to take my cotton rounds. I'm going to make sure that my toner sprayer does not come into contact with my cotton rounds. and then we want to exfoliate. So I'm going to get a little bit of the exfoliant, I'm going to spread it around a little bit, and then I'm going to be massaging it in. Like anything you apply, you're going to always avoid the nose, the eyes, and the mouth when you're applying it. But with your exfoliator, you're going to first start by massaging it in for 1 to 2 minutes. You're going to follow the manufacturer's instructions, of course, but we are going to massage it in for 1 to 2 minutes. And then I'm going to review what would happen at this point. So we would retrieve the steamer, turn it on, position the steamer next to the facial bed, make sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, position the steamer 16 inches over the client's face and aim it at the client's chin for even distribution on the face. Allow the unit to function for 3 to 5 minutes. Then remove the steamer from the client's face, return the steamer to its previous location for disinfection. So we would be bringing that steamer, which we don't have, over to the bed, making sure that it's facing away from our client to turn on. Then it's going to get that steady stream of the mist. And at that point, you can turn it towards the client's chin, about 16 inches away, making sure that the steam, it'll go up and over the face, and we would leave it there for 3 to 5 minutes. Obviously, we don't have the steamer, and we're also doing a video, so we're not going to wait for 3 to 5 minutes, but just so you know, that's what would happen. And then that time elapses, you turn it away from the client, take it back where you got it from, and turn it off. So it's just out of the way, out of the client's way, in your way. And then you're going to remove your exfoliant. So I also don't have a hot cabbie, so I'm going to get my steam towel from over here, and I'm going to shake it out as if it was coming out of that cabbie. It's hot. And then I'm going to check that temperature on my wrist. And once I feel like it's okay, I'm also going to come in and check it on my client's collarbone. She thinks it's great, so I'm going to do my little fold here, pretty fold, and I'm going to bring it over to her face, and I'm going to lay it on the face and cover up her face except for her nose so she can breathe. And you have about 20-30 seconds before you start to feel it cooling off, so then you can just remove your exfoliant. And then you'll want to dry your hands off really good because you are going to go to your extractions now, and you need to wear gloves for that. So just making sure my hands are nice and dry, and I'm going to put my gloves on. Got a pair of disposable gloves here. Still, my hands still wet. And there's two ways that you can perform extractions. You can use these wooden stick Q-tips. You can also use cotton rounds soaked in astringent and kind of like around your finger, and then, you know, applying pressure, working your way around and toss. I'm going to use the Q-tip method. You also may want to bring your magnifying lamp back over and turn it on. If you want to do that, working through the magnifying lamp, you will cover your client's eyes, just so you know, because you don't want to have the lamp over them. The really good news is that she does not have a lot that needs to be extracted. So we're just going to do the few extractions that we need to. And when you're doing extractions, you want to make sure that you don't do any of this for more than 3 to 5 minutes. No, 5 to 7 minutes, because it can get uncomfortable and we don't want the client to feel uncomfortable. It can be somewhat painful sometimes. But she's more worried about dry, dehydrated skin. She doesn't have a lot of congestion in her skin, so we're going to have one more extraction. So that's where we're spending our time, and our focus today is about that, getting her skin hydrated, glowing, getting that exfoliating off any of that dry, dull flakiness. So I'm going to take the magnifying lamp out of the way. I'm going to take these off and toss them, and then I'm going to also take off my disposable gloves, throwing them away. And of course I threw away my wooden stick Q-tips for the extraction immediately. So all of that needs to go out of the way. And then we're going to finish the extraction process with toner. So you exfoliated, extracted, and then we're going to tone. So getting some cotton rounds once again, not touching the sprayer to the cotton rounds. We're going to tone. And the really good thing about getting through the extraction process is after that it's massage. So she gets a nice relaxed time now. So she's going to get to the massage portion of the facial, which is great. So just make sure you get enough of the massage product before you start the massage, so that you don't have to go back in and add any more to the client, because once you start your massage, you want to make sure that your hands never leave the client until you're done. So all I'm doing is spreading out my massage product across my client, so I know that each area that I go to during the massage, that there will be enough massage product there when I get there, and I won't have to stop the massage for any reason. need to remove your massage product. And then now you're going to apply the mask to your client. I'm going to use the brush to apply my mask. And like everything else, we are avoiding the eyes, nose, and the mouth, of course. And then you would always follow manufacturer's directions as far as a timeline for how long your mask should be on, anywhere from 5 to 10 minutes. But because we're doing the video, we're not going to sit here for 5 to 10 minutes. We're just going to go ahead and remove that mask step and make sure you know what's the appropriate timeline and what you should be doing. once the mask is removed, we are going to tone. And once you finish with this final toner, you're going to apply her skincare that she's going to leave in. So I'm going to apply some eye cream, and I'm going to apply some moisturizer with a great SPF. We're going to talk more about that. We already talked in the client consult a little bit about the importance of SPF. This is a great eye cream here. So I'm applying it to the brow bone and the zygomatic arch with my ring finger, really delicate finger, so it won't be, this is a delicate area, it won't be harsh. And then I'm going to get that moisturizer with SPF, and I'm going to apply it anywhere that the sun might hit her, where she might be exposed. So the neck, the face, of course, the décolleté, and we will be reiterating the importance in her daily moisturizer to have that sunscreen when we check out and in just a minute and go through that process. We're going to finish up the facial. And then we would give her, of course, privacy to get back into her regular clothing and meet us in the client area, waiting room, so that we can finish up. And what we would do to finish the facial is we would go over any kind of maintenance and aftercare that she might need, sending her home with that aftercare kit, and then of course recommending her next booking timeline, getting her booked in the system, and then making sure she's going home with any products, because she's going to be at home more than she is with you. So it's so important that she's doing what she needs to do to support the work that you're doing here at home. So we take care of all of that, get her checked out, and then we need to come back and clean up our room for our next client who's also coming for a facial. So we need to discard any single-use items that haven't already been discarded, and then we're going to place any implements that we might have used in a closed container labeled to be disinfected. All of the bedding, the sheets, the towels, etc. that we used will go in that laundry container with a lid in order until we do the laundry. And then we need to identify a proper cleaning agent, read manufacturer's directions, follow manufacturer's directions for mixing and usage. We're going to wipe down our workstation and area, excuse me, with that cleaning agent to remove any debris. Then we're going to identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting, which means you're going to need a new pair of disposable gloves. We're going to follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. We will disinfect any electrical equipment and store it in a clean area separate from other implements. And then you can take off that other pair of disposable gloves, trash them, and it's time for you to wash your hands again. So you're going to wet your hands at the sink, coin-sized amount of liquid hand soap. You're going to wash your hands together down to the wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash those fingertips and nails. You'll wash between your fingers and your thumbs. You're going to wash your thumbs. You're going to wash your wrists. You're going to do all of that for a minimum of 20 to 30 seconds, and then you thoroughly rinse everything underneath the water. When you feel like you've properly rinsed, grab those disposable paper towels or a clean towel, turn the faucet off, dry your hands off thoroughly, trash the paper towels, and then put the dirty towel, if you use that, into that container with a lid until it's time for laundry. Then find that 70% ethyl alcohol hand sanitizer and sanitize those hands up. And once your hands are thoroughly sanitized, you are done with your basic facial and you can start preparing for your next client.